Introduction to eyelash extensions. Eyelash extensions have become a highly sought-after beauty treatment, offering clients enhanced lash length, volume, and curl without the need for daily mascara. This course provides a foundational understanding of the industry, covering everything from client care to advanced application techniques. Mastering these skills is crucial for delivering safe, beautiful, and long-lasting results that satisfy client expectations. Understanding the various types of lashes and adhesives available is also a key component of this introductory phase. This diploma aims to equip you with the expertise to confidently offer this popular service. You will learn to navigate the intricacies of lash artistry, ensuring both aesthetic appeal and client safety. The journey begins with a thorough overview of what makes a successful lash technician. The demand for skilled eyelash extension specialists continues to grow, making this a lucrative and rewarding career path for beauty professionals. This course will guide you through the entire process, from initial client contact to post-treatment care and maintenance. We will explore the nuances of different lash styles and how to customize them to suit individual eye shapes and preferences. By the end of this program, you will possess the confidence and competence to build a thriving lash business. This includes understanding client psychology and building strong, trusting relationships. Prepare to transform natural lashes into stunning works of art, enhancing natural beauty with precision and care. Industry regulations and standards. Adhering to industry regulations and standards is paramount for any professional offering eyelash extension services. These guidelines are put in place to ensure the safety of both the client and the technician, maintaining high levels of hygiene and service quality. Compliance involves understanding local health and safety laws, as well as specific beauty industry codes of practice. Failure to comply can lead to severe consequences, including fines, loss of license, and damage to professional reputation. Staying informed about updates to these regulations is an ongoing responsibility for every practitioner. This commitment to standards builds client trust and ensures a safe working environment. It also reflects a dedication to professionalism within the beauty sector. Health, safety, and hygiene. Maintaining impeccable health, safety, and hygiene standards is non-negotiable in the eyelash extension industry to prevent infections and allergic reactions. This includes rigorous sterilization of all tools and equipment before and after each client, using disposable items where appropriate. Proper hand-washing techniques and the use of gloves are fundamental practices to minimize cross-contamination risks. The workspace must be kept clean, well ventilated, and free from clutter to ensure a sterile environment. Implementing these protocols protects both the client's delicate eye area and the technician's health. Regular disinfection of surfaces and proper waste disposal are also critical components. These measures are the bedrock of a trustworthy and professional service. Professional insurance coverage. Professional insurance is an absolute necessity for any individual or business offering eyelash extension services, providing crucial protection against potential liabilities. This coverage typically includes public liability insurance, which protects against claims of injury or damage to property occurring on your premises or as a result of your work. It also often encompasses professional indemnity insurance, safeguarding against claims arising from professional negligence or advice. Having adequate insurance provides peace of mind, allowing technicians to focus on their craft without undue financial worry from unforeseen incidents. It demonstrates a commitment to responsible business practices and client welfare. Always ensure your policy specifically covers eyelash extension treatments. This legal and ethical safeguard is fundamental to operating a legitimate business. Client consultation process. A thorough client consultation is the cornerstone of a successful eyelash extension service, ensuring client satisfaction and safety. This initial meeting involves discussing the client's desired look, lifestyle, and any previous experiences with lash extensions or allergies. It is essential to manage expectations regarding the achievable results based on their natural lashes and eye shape. Detailed consultation forms should be used to gather crucial information, including medical history, eye conditions, and contact lens usage. This process allows the technician to assess suitability for the treatment and customize the application plan accordingly. Building rapport and trust during this stage is vital for a positive client relationship. A comprehensive consultation prevents misunderstandings and ensures a tailored, safe experience. Client assessment in eye health. Before any application, a meticulous assessment of the client's natural lashes and overall eye health is critical to ensure the safety and success of the treatment. This involves examining the strength, thickness, and direction of the natural lashes to determine the appropriate weight and length of extensions. The technician must also inspect the eyelids and eye area for any signs of irritation, infection, or underlying medical conditions. Conditions such as conjunctivitis, styes, or blepharitis would contraindicate the treatment. Observing the client's eye shape and bone structure is also important for selecting the most flattering lash style. This detailed assessment helps prevent adverse reactions and ensures the longevity of the extensions. It is a vital step in providing a responsible and customized service. Absolute contraindications. Absolute contraindications are conditions that completely prohibit the application of eyelash extensions due to significant health risks to the client. These include active eye infections such as conjunctivitis, styes, or pink eye, which could worsen or spread with treatment. Any recent eye surgery, including LASIK or cataract surgery, typically requires a waiting period of several months before extensions can be considered. Allergic reactions to previous lash applications or adhesive components are also absolute contraindications. Clients undergoing chemotherapy or radiation treatments, or those with highly sensitive eyes prone to severe irritation, should also be declined. Prioritizing client health means strictly adhering to these rules. Ignoring them can lead to serious complications and legal issues. Always err on the side of caution when an absolute contraindication is present. Relative contraindications are conditions that require careful consideration and potentially a modified approach before applying eyelash extensions, rather than an outright refusal. These might include mild allergies or sensitivities that could be managed with hypoallergenic products or a patch test. Clients with very weak or sparse natural lashes may still receive extensions, but with lighter, shorter lashes to avoid damage. Pregnancy or breastfeeding often requires a doctor's note and a patch test due to hormonal changes and increased sensitivity. Similarly, clients with thyroid conditions or alopecia might experience poorer retention, necessitating a thorough discussion of expectations. It is crucial to assess each case individually and communicate openly with the client. Always prioritize their comfort and safety, making informed decisions. Sometimes a smaller, less intense application is appropriate. Point. Precautions and patch testing. Implementing strict precautions and conducting thorough patch testing are essential steps to mitigate risks and ensure client safety before applying eyelash extensions. A patch test involves applying a small amount of adhesive to a discrete area of the skin, such as behind the ear or on the inner elbow, at least 24 to 48 hours prior to the full application. This helps identify any potential allergic reactions to the adhesive, which can range from mild irritation to severe swelling. Technicians must also take precautions like ensuring proper ventilation in the workspace and using medical-grade, formaldehyde-free adhesives. Always discuss any client concerns or sensitivities during the consultation. Documenting patch test results and client consent is also a crucial part of professional practice. These preventative measures protect both the client and the technician from adverse outcomes. Eyelash extension products. A wide array of eyelash extension products is available, each playing a crucial role in achieving diverse lash looks and ensuring client satisfaction. Individual lashes made from synthetic mink, silk, or flat ellipse fibers come in various lengths, curls, J, B, C, D, L, M, and thicknesses to customize the desired effect. Adhesives, or glues, are formulated with cyanoacrylate and vary in drying time, retention, and fume levels, requiring careful selection based on technician skill and client sensitivity. Primers and bonders are used to prepare the natural lashes, enhancing adhesion and retention. Sealants and coatings help protect the extensions and prolong their lifespan. Understanding the properties and proper use of each product is fundamental for successful application. Quality products directly impact the final look and durability of the extensions. Always use reputable brands to ensure safety and performance. Essential tools and equipment. Having the correct tools and equipment is indispensable for precise, hygienic, and efficient eyelash extension application. Key tools include various types of tweezers, isolation tweezers for separating natural lashes, and application tweezers for picking up and placing extensions. Eye pads or medical tape are used to secure lower lashes, protecting the delicate under-eye area. A lash tile or palette provides a clean surface to organize and work with individual lashes. Micro brushes, applicators, and cleansing brushes are essential for preparation and aftercare. A magnifying lamp is crucial for clear visibility and precision during the intricate application process. Disposable items like mascara wands and lint-free wipes ensure hygiene. Investing in high-quality, ergonomic tools enhances both technician comfort and client results. These tools are the extensions of a lash artist's skill. Workspace setup and preparation. An organized and hygienic workspace is fundamental for delivering professional eyelash extension services, ensuring both client comfort and technician efficiency. The treatment area should be clean, well-lit, and free from distractions, with a comfortable, adjustable treatment bed or chair for the client. Proper ventilation is crucial to minimize exposure to adhesive fumes, protecting respiratory health. All tools and products should be meticulously arranged within easy reach, following a logical workflow to avoid unnecessary movement. Disposable items must be readily available, and a designated waste receptacle should be used for proper disposal. Maintaining a sterile environment is paramount, with all surfaces disinfected before and after each client. An ergonomic setup also prevents technician fatigue and promotes precision. A well-prepared workspace reflects professionalism and attention to detail. Client preparation for application. Proper client preparation is a critical first step in the eyelash extension application process, ensuring optimal adhesion and a comfortable experience. Clients should arrive with clean, makeup-free lashes, as any residue can hinder the adhesive bond. The technician will further cleanse the natural lashes using a specialized lash shampoo or primer to remove oils, dirt, and any remaining makeup. Eye pads or medical tape are then carefully applied to secure the lower lashes, preventing them from sticking to the upper lashes during the application. This also protects the delicate skin under the eyes. The client's eyes must remain closed throughout the entire procedure to prevent irritation from fumes or accidental contact with products. Clear communication about these steps helps clients feel relaxed and informed. A well-prepared canvas is essential for a flawless application. Individual lash application techniques. Mastering individual lash application techniques is at the core of creating beautiful and long-lasting eyelash extensions. The process begins with isolating a single natural lash using isolation tweezers, ensuring it is completely separated from its neighbors. Next, an individual extension is carefully picked up with application tweezers, dipped into a small bead of adhesive, and then gently placed onto the isolated natural lash. The extension should be bonded approximately 0.5 to 1 millimeter away from the eyelid, never touching the skin, to prevent irritation and allow for natural lash growth. For direction and angle of placement are crucial for creating a seamless and natural-looking fan. Each lash must be applied individually, ensuring no stickies or clumps occur. This meticulous process requires patience, a steady hand, and keen attention to detail. Proper technique ensures comfort and optimal retention for the client. Lash mapping and styling. Lash mapping and styling are artistic techniques used to customize eyelash extensions, creating a flattering and desired look for each client. This involves drawing a map on the under-eye pad, dividing the lash line into sections and indicating where different lengths, curls, and thicknesses of extensions will be applied. Common styles include natural, which follows the client's natural lash line; doll eye, which uses longer lashes in the center to open up the eye; and cat eye, which places longer lashes towards the outer corner for an elongated effect. Understanding eye shapes, almond, round, hooded, monolid, is crucial for selecting the most suitable map. The goal is to enhance the client's natural beauty, correct perceived imperfections, and achieve symmetry. Effective lash mapping ensures a consistent and aesthetically pleasing result. This personalized approach elevates the lash extension experience. Common application challenges during eyelash extension application. Technicians may encounter several common challenges that can impact the final result and client satisfaction. Stickies, where two or more natural lashes or extensions are glued together, are a frequent issue that can cause discomfort, damage natural lashes, and lead to poor retention. Inadequate isolation of natural lashes is often the root cause of stickies. Poor retention can also result from improper adhesive application, using too much or too little glue, or working in unsuitable environmental conditions, humidity, temperature. Rushing the application process or using low-quality products can also lead to unevenness or premature shedding. Learning to identify and correct these challenges is vital for developing advanced skills. Patience and meticulous attention to detail are key to overcoming these hurdles. Continuous practice and refinement of technique are essential for mastery. Post-application care and curing. Effective post-application care and proper adhesive curing are crucial for maximizing the longevity and appearance of eyelash extensions. After all extensions are applied, it is important to fan the lashes using a small fan or air blower to help cure the adhesive and disperse any lingering fumes. Some technicians use a nano mister, which emits a fine mist of purified water to shock cure the adhesive and hydrate the eye area. Reducing irritation. Clients should be advised to avoid contact with water, steam, excessive heat, and oil-based products for the first 24 to 48 hours after application. This allows the adhesive to fully cure and form a strong, lasting bond. Providing clear, concise aftercare instructions verbally and in writing is essential. This initial curing period significantly impacts the retention of the extensions. Proper post-application steps ensure client comfort and satisfaction. Aftercare advice for clients. Providing comprehensive aftercare advice to clients is vital for maintaining the beauty and longevity of their eyelash extensions and ensuring eye health. Clients should be instructed to gently cleanse their lashes daily with a specialized lash shampoo to remove oils, makeup, and debris, preventing infections and poor retention. They must avoid oil-based products around the eyes, as oils can break down the adhesive bond. Brushing lashes daily with a clean mascara wand helps keep them neat and prevents tangling. Clients should also be advised against rubbing, pulling, or picking at their extensions, which can damage natural lashes. Avoiding excessive heat, such as from saunas or direct hot shower streams, is also recommended. Regular infill appointments are necessary to keep lashes looking full. Clear, written instructions reinforce verbal advice. Empowering clients with proper aftercare ensures their satisfaction and the health of their natural lashes.